Hey everybody, Calvin Kim here. Today I want to talk to you about an issue that's coming through my office a lot these days. Tennis elbow or lateral epicondylitis. But let's go with tennis elbow. Lateral epicondylitis has way too many syllables. What is tennis elbow? Tennis elbow is when you have a pain on this point of your elbow. Not on the inside, but on the outside of the elbow. People usually have pain here. They can have it 24 hours a day. They can have it when they're typing or when they're lifting something. They call it tennis elbow because you see it in a lot of tennis athletes, because when they do a backhand, they use this muscle repeatedly over and over, and it leads to an injury at this side of the elbow. This part of the elbow is where a bunch of muscles in your arm attach. What do these muscles do? These muscles are responsible for this motion: extending, opening your fingers, moving your wrist up like this, or holding and lifting like you would do in a tennis stroke. When you do this repeatedly over weeks, months, years, sometimes decades, it leads to an injury at this part of the elbow, causing the pain. Now, most of my patients who come through my office say, you know what, Calvin? I don't even play tennis, so why would I have tennis elbow? And this is true. But what I'm finding in my office these days, what most people have in common who are complaining of this pain, is they're all on the computer. Because when you're on the computer and you're mousing, you're lifting your fingers, you're lifting your hand, and that can actually cause tennis elbow. So what can you do for this pain of tennis elbow at home? One of the first things you can do is ice, baby. No heat. Heat will actually make it worse. When you have tennis elbow, it's inflamed and swollen, so you need to apply cold to help the swelling and pain reduce. I suggest a cold pack for about 5 minutes. Or what I would recommend is take an ice cube and do a little ice massage on that point of area that hurts for about 5 minutes. You can do that 5-6 times a day. The other thing you want to do is keep the area moving. The range of motion is the term we like to use. So just put your arm out and just do this 10 times. That's 1, 2, and repeat this 10 times. This will help stretch the muscle, keep it moving, and get the blood flow going, which will help with the healing. One of the other things you can do is to stretch it. Now, the best way to stretch this is put the arm out. Make a loose fist and pull the arm down. And you should feel that stretch all the way through your arm right to the elbow where the point of pain is. So pull it down and hold it for 30 seconds. If you want the stretch to work, you can't do it for a short period of time. 30 seconds, shake it out, loose fist again, pull the arm down. 30 seconds. Do that at least 3 times every hour. One of my other favorite stretches for tennis elbow, a little more complicated. So this is the affected arm. You're going to push this hand back like this and then turn your thumbs out and then hold that again. 30 seconds, 3 times. Again, push the arm up and turn the thumbs out and hold for 30 seconds. One of the other things you can do is use braces. The most common one is the tennis elbow brace. You can put that here and put it on your elbow, but you'll find you can still cause pain with this. This will help just reduce the pain. Now, if possible, the best thing to do is to prevent your arm from doing this motion. So this kind of brace would be ideal. Now, this brace has a steel bar here and here, so it prevents you from doing this and this. So if able, with your work or whatever activities you're doing, wear this kind of brace. And this will prevent you from bending and extending the wrist, so you will not stress these muscles at all. And of course, you have to avoid the activity that's causing the pain, but that is not always possible in this day and age. So if none of these things help, or your pain doesn't get better or worsens, give us a call at the office. We have many treatment options we can offer you. We have shockwave, needle acupuncture, ultrasound. We have great massage therapists who can help with your injury. But try these first, and if they don't work, give us a call. Thanks for listening, everybody.